if you haven't forgotten me. But you know, it's important to understand that a lot of folks, they just discovered in 1991 the endocannabinoid system. And for those who don't know, you know, cannabinoids are the medicinal compounds in cannabis. Well, we actually have an internal system of cannabinoid receptors. That's the endocannabinoid system, and we actually can produce cannabinoids. Some people are cannabinoid deficient. And that's where cannabis comes in, because it actually can supplement people who are endocannabinoid deficient, and it does speak to people who have heroin addictions, people who have addictions to alcohol, people who have a lot of different addictions. It actually quiets their nerves. I've talked to a lot of people who have suffered many, many different illnesses, and they're off of many pain pills, they're off of many psychoactive or psychotic medications, things like that, because it actually is, our bodies are designed to accept these cannabinoids like a plug into an outlet. We've been used to cannabis for over 10,000 years. There's evidence going way back in history that every culture on the planet used cannabis medicinally. You used it for food, and they also used it for religious ceremonies. So it's been with us. It's only been in the last 77 years that somebody had the idiotic idea to make it illegal. Yeah.
We have another question here if you'd like to say your name and state your comment or question.
Sure. My name is John Robinson. I would have to say I'm probably one of the few people here that doesn't smoke marijuana. But as a former cancer patient who, when they were 15, went 8 weeks only able to eat 3 meals because the chemo and the radiation was tearing apart my body, plus having seen how marijuana affects a close friend of mine that has MS, plus while at a pediatric cancer hospital, I saw the medical professionals allow them, the parents, to treat their kids who had cancer with marijuana. As a doctor, you say you have a responsibility to the addicted. Don't you have a responsibility to the cancer patients as well?
And, so, I mean, what those doctors did, I think, is fine, but if you're going to put it in a bottle and say it's medicine, then I think that's a whole different ballgame.
If it works, it is medicine.
Yeah.
Now, folks, be very patient waiting in line. We want to get to as many as possible. Come on,
I just
right
say,
up,
you know, if you gave somebody a drink of alcohol,
Cornett.
they're going to calm down too. Should we start saying alcohol's medicine because it calms people down?
Yes, my name is Todd Cornett, and my question is directed towards Mr. Matson. Have you ever smoked marijuana before?
I have not.
Okay, but I have chronic deterioration in my back, and the doctor has prescribed all type of pills for me, and I actually got addicted to the pills, like Percocet and Vicodin, and you know the pills now are, the pills are just the way the trafficking and pills and stuff are, but they don't want you to have the pills, they don't want you to have coke, they don't want you to have nothing that will help you. Now marijuana help you. What would you say would work for us? Besides, you know, you say marijuana, you don't want us to have it, what would you want us to have if it works?
Well, number one, I'm not saying I don't want you to have it, because if it made you feel good, fine. I just don't want you to call it medicine.
Well, if it works like you just said, it is medicine. Vote medical!
Can I say on this too that, do we have time for the question?
Yes.
Okay,
One thing I'd like to speak to real quick is the fact that our system, our medical system, is structurally set up to push people away from cannabis and push them onto the deadly pharmaceuticals. You know, unfortunately, they don't. The thing about it is that's really lost in here is cannabis is the toxicity is zero. You cannot die from cannabis. There's no such thing as a cannabis overdose. There is such a thing as an overdose of OxyContin, of Vicodin, all these other drugs that are currently legally allowed to be prescribed. And so, if you want to talk about do no harm, that's cannabis.
Let's go quickly over to the social media center. Adam Slinger.
Bob, one of the questions we've seen over and over again tonight relates to medical marijuana in the workplace. This person writes, my company has a zero-tolerance drug policy. If medical marijuana becomes legal, could I be fired if I'm prescribed medical marijuana and I use it?
You can be fired now. That's the problem. You know, again, it's a discrimination thing. We Ohio Rights Group and our amendment does not allow people to, to go to work or operate heavy machinery intoxicated. We don't want to see people strung out on alcohol, on sleep medication, or anything else that's going to impair them. However, people who are using cannabis effectively, and they can use strains that do not affect their impairment, and they can still do their job and function. I know a lot of people that use cannabis on an everyday basis, and they are amazing people. They work their butts off. They're smart. They're hardworking. There's this perception out there if someone's using cannabis, they're couch locked and they can't function. That's not the case. The vast majority of people that I know that use it medicinally are very high functioning, very literate. Very intelligent people, and it seems to speak to who they are as a person, and they're smart enough to know that it's safer than most of the pharmaceuticals out there, so they're making a very conscious choice to use a homeopathic medicine that they know that was given to us by God and meant for human beings to consume. So,
I was told that I could bring experts. I was told that I could bring experts, and Dee Mason is an expert in the workplace. So I would like if she could speak to that, please.
But I'm told we can't have any more comments right now and with the live version.
Yeah.
When we go online streaming only.
Yeah.
To just state that, though, that real research has been done that has shown increased workers' comp, much more days lost to work, more accidents at work.
Absolutely.
Like when they suffocated the monkeys too, right?
come on, guys.
All right, another question.
Are you saying in comparing to nothing, or are you saying in comparison to
We have 30
opioid
seconds,
usage?
Bob.
Because you know what? If somebody takes a Vicodin and drives a forklift, they're probably more likely to have an accident
When
too.
you're
But
impaired,
we're
you're
talking
impaired.
about
I don't believe in that
medicine.
either.
When you're impaired,
Well, but
you're
the point
impaired.
is why is
Well, we-
cannabis the only thing that's
we
held
do
to a
have
higher
to wrap
standard?
with that.
Hold on a second,
Pause.
folks. We're just going
It
to take a
is.
quick break here. We're on broadcast and also online tonight. We're going to continue on with our online in a moment. And thanks to all of you who have joined us once again on abc6onyourside.com. Continuing on with our town hall meeting tonight from the Columbus Museum of Art. Bob Kendrick here along with Yolanda Harris, Chris Van Oker, and Adam Slinger, and a very passionate audience tonight, and panel as well. You're doing a great job of hanging in there, panel, especially on the left-hand side. Let's get another question here from
We're
our
going to
audience.
continue with our questions. Thank you.
My name's Kevin Spittler. I ran a medical marijuana dispensary in Kalamazoo, Michigan for about 3 years. We actually did a year-long study with Wayne State University, and where we collected thousands of data points. And once put together, what that had shown is cannabis allows for addictions to end. All right? Plain and simple. That was a double-blind study through a major university in the state of Michigan for a whole year.
Have you published that?
I'm just explaining that we did
Well,
do
have
a
you
study.
published it? If you do, then send it to me. I'd love to see it.
Okay, I will do that.
So again, real research gets reviewed by peers that look at it and decide whether it's real or not. I've never seen a paper looking at marijuana treating addiction.
Come on up
Well, the thing
and
that's
state
really
your name
upsetting to
and-
me is the fact that they're always talking about cannabis being a gateway drug. Cannabis is not a gateway drug. It's a step-down drug. They were prescribing cannabis for opium addiction back in the 1930s before it became illegal. Doctors were using that to help people get off of more dangerous, like alcohol, like prescription drugs, and opiates, and things like that. There's what's called a pill mill, what's going on here in the United States. We have some of the worst outcomes on the planet because of the amount of dangerous pharmaceuticals that are being pushed on our public, and it's about time people are given a safe, alternative that's natural, that doesn't kill people, and gives people an option other than the stuff that's very dangerous.
Well, there's a stigma. I know, John, there are others who will say, though, that if you start with marijuana, it seems like a reasonably benign, and we've heard sentiments to that effect a lot tonight, it's a reasonably benign place to start recreationally medicating yourself, feeling good. And now that your mind has been expanded to, hey, what the heck, it feels good, maybe this other thing will feel good too. And I think that's the argument about it being a gateway drug, is it's a pretty easy place to start. I guess the same thing could also be said about alcohol, but how do you respond?
Well, what they're seeing, the studies are showing the fact that the biggest gateway really are the opiates. What happens is someone's in a pain management program and they're taking opiates, and either the opiates become ineffective because they've become intolerant, or they get kicked off the program because they hit a wall and they're still addicted. So what do? They go to heroin. So that's the true gateway right there. Are the prescription drugs.
Can I just say that, I mean, weed is the first high that people learn. That's the first high that adolescents learn.
I'd like to, when he's done, I'd like
When
to
you,
have
all addictive drugs are driven by dopamine. Weed is the same way. It falsely raises dopamine levels, and it's the first high all adolescents learn. And those, a lot.
Hey, come on, guys.
Don't. We know this for sure. We know that dopamine drives it, and by hijacking that dopamine system, marijuana does exactly the same thing as every other drug of addiction.
I do want to get some fewer
And
questions.
Mount
Okay, we have a
Sinai
question real
just
quick.
came out
Let's
with 120 different studies that they looked at that shows that these particular studies show that marijuana leads to a greater drug use. And so, I mean, it's Mount Sinai and other studies that show that you're 5 times more likely to move into other drugs. Another study showed that cocaine, you're 8 more times to move into that, and heroin 15 times more likely to move into that if you start with marijuana. Not everybody, but some people.
All right.
And the one person is, the one we care about.
All right,
Most
Marcy,
people
thank
don't
you.
start
Let's
with
get a question.
marijuana. They don't start with marijuana.
My name is Judy Fouché, and I had tongue cancer. And due to the treatments I had, the extensive surgery, chemo, and radiation, I have a very difficult time eating, and I have hardly any taste buds whatsoever. So because of that, I don't eat too well. So anything that's going to help me to have an appetite, because I struggle every day to eat, so that does not